نور الصفا مرتبي رسول أحمد مصطفى وبصلنك نش إمام لول النتيبة نبي طبيب.
It's time for Mums, Bums and Little Ones. We're talking about TB awareness now. Tuberculosis. TB is a serious infectious disease that primarily affects the lungs, though it can spread to other parts of the body. Understanding TB is crucial, of course, for public health, especially in regions where it is prevalent. Now, this interview aims to address common questions about TB to increase our awareness and provide vital information on its management and prevention, inshallah. We are joined on the line by Dr. Farzana Ismail, who is a clinical microbiologist at the Center for Tuberculosis. It's the National Institute for Communicable Diseases Division of the NHLS in Johannesburg, and she also leads the World Health Organization Supranational TB Reference Laboratory section of the center. She has a keen interest in drug-resistant TB, diagnostic technologies, infection control, and patient-centered care for TB, providing support for specialized testing to clinicians managing highly resistant TB patients. She plays a pivotal role in diagnostics policy for South Africa and was instrumental in the rollout of the national DRTB reflex testing algorithm for second-line drug susceptibility testing. She is a member of the World Health Organization Technical Advisory Group on Tuberculosis Diagnostics and Laboratory Strengthening and has participated in WHO guideline development world meeting for different diagnostic tools, including the development WHO policy documents. When I say who, you know, it's World Health Organization, subhanAllah. She is also a senior lecturer at the University of Pretoria, involved in training undergraduate and postgrad students in clinical microbiology and infection control. So alhamdulillah, we have the perfect person on the line to chat with us more about TB. Assalamu alaikum, Dr. Farzana Ismail, and welcome to Urban Women.
Walaikum salam and jazakallah for having me on the show today. I'm a bit under the weather, so I just hope that my voice holds.
Inshallah. Well, we do appreciate your time, even though you're not feeling so great. I do know many people are getting sick. May Allah grant us shifa wa afia, inshallah. Now, Doc, you know, if we could jump into it, some people have this misconception about TB. If they're not aware of what it really means, they can often link it in the same bracket as HIV. To be honest with you, this is people's mentality. So help us to understand, what is TB, tuberculosis?
Okay, I think that it's important for us in South Africa to definitely understand what TB is, because it is so common in our country and also in sub-Saharan Africa and Africa as a whole. And yes, there is a misconception because people link TB, HIV together. It's true that we have a high proportion of HIV individuals, people living with HIV, who have TB, and that's because the immune system is compromised, so they are more susceptible to getting TB than those who have an intact immune system, if I could say it as that, right? So TB is an infection that affects mainly the lungs. It's contagious, which means it is passed on from person to person. The way it's transmitted is the same as COVID has been transmitted. Okay, so we've learned a lot during our COVID times. And I must say that it's become a bit more acceptable nowadays to wear masks. People understand, okay, if we're coughing and we're sneezing, we should be coughing into our elbow. That's cough etiquette. We shouldn't be in closed environments. If we are ill, we should rather stay at home. So the transmission is the same way. Someone who is sick with TB, when they're coughing, when they're sneezing, or when they're talking out loud, there's tiny droplets that are being produced. And these droplets actually have the TB bacteria, which is called Mycobacterium tuberculosis. These are then propelled into the air. And when there's other people within this environment, they breathe these in as they're settling towards the ground. And that is how people become infected with TB.
Okay, so we know that it's common in South Africa, right? What about globally? What would you say? As common as South Africa?
So, in fact, sometimes more common, right? Every year, the WHO releases a document which looks at the global prevalence of TB throughout all the different countries. So in 2022, which is the latest statistics that is available, there were more than 10.6 million people in the world that were infected with TB. So it's relatively common, but more so in countries that have a low socioeconomic status. So those countries that are developing countries, and really where the socioeconomic status is really not great. There's a lot of crowding, right? And South Africa forms part of that because we have a society that has, the very well off and well-to-do, and we have our informal settlements. So we have both worlds within our country.
Indeed. Indeed. So how does TB spread? Just like how, you mentioned if we sneeze and we do not block the sneeze, which of course we know is a sunnah. Our beloved Master Sallallahu Alaihi Wasallam says, cover when you're sneezing because of the same thing, droplets. And of course you are explaining to us scientifically as well. Is that the only way that it could spread?
It's the most common way of spreading because it's not as other diseases where if you touch someone, for example, that has TB, that they would be getting TB. Like in cases of diarrhea, we say it's contact spread. That's not the case. It has to be propelled into the air and then breathed in. In very rare, very, very rare situations, it can be through surgical transmission if there's an operation happening, but then it's absolutely rare. So for us, and I think for the listeners, for everybody that's listening, and for all people who want to understand TB is transmitted by breathing in the bacteria when someone who's infected is coughing or sneezing it out.
Okay, so important that we be aware and try and take our protections as well. Doc, if you could just explain some of the symptoms to us about TB, and also when do you suggest that we actually see a doctor?
So the symptoms that we have for TB, they are quite common and they're not exactly 100% specific for TB. And the most common symptom that people experience is coughing, right? Because it's a bacteria that primarily affects the lungs. So one would experience coughing, and sometimes this cough is for a prolonged period of time. And we usually say that if you're coughing for more than 2 weeks, then we need to start thinking that this might be TB. But bear in mind, it could be other things as well, right? So coughing is very common. Then there's fever. There's night sweats. And the important thing about night sweats is not to say and to confuse it with when it's a hot summer's night and it's humid and we're sweating. What the patients actually describe is that they perspire so much that they actually have to change their clothing and their bedding because it gets so wet. So that's profuse sweating, right? And then people can also experience unintentional weight loss. And we have to ask this question about weight loss as unintentional because there are people who want to lose weight. So if you're seeing this, a person in front of you as a healthcare worker, you need to specify if the weight loss is unintentional. So you're eating, but you're just losing the weight, or you're just not gaining weight at all. It could be that you're just staying the same, same weight along many, many years or many, many months, and you're just not gaining the weight. So it's not necessarily weight loss. So those are the most common symptoms. And there's also fatigue and tiredness, because if you're coughing for such a long period of time, daily, the entire day, you would feel some sort of tiredness. So those are the common symptoms, but they're not 100% specific for TB. That's why it's important to visit your healthcare facility and see your healthcare provider so that they can do other tests, ask you other questions that would maybe direct them into the correct diagnosis. Is this TB, or are we dealing with something else here?
So just don't leave it. If you experience any of the symptoms that Dr. Farzana Ismail has shared with us. Now, how is TB then diagnosed, doctor? And also, if you could share with us the process of getting tested for TB.
Okay. So TB is diagnosed also in the same way that we would have COVID testing being done. I'm not sure if the listeners are familiar with the word PCR, but it was a term that was thrown around a lot during COVID times, right? Did you get a PCR for COVID? So testing for COVID has evolved to antigen testing, etc. That's not what we're doing for TB. You need to do a molecular test. It is done in the lab. Okay, so there isn't a test currently where you're in the doctor's rooms and they can do like a finger prick as we do for glucose testing, and there you have your diagnosis for TB. we need to get a sample. So we call it a specimen. And this specimen is, the phlegm that is being coughed up when you're coughing and you have that gunk that comes out. That
Yep.
is what we actually require to be submitted to the lab and then
Mhm.
gets tested. And the test tells you whether that TB is present or not. And it also provides you with a resistance for one of the drugs that is used for treating TB. So we know which treatment regimen to put the patient on, right? The TB testing in the public healthcare sector in South Africa is free. So any healthcare facility that you would be visiting, a clinic or a hospital, has access to TB testing. The healthcare provider will request you to submit a sample. They would give you a small container. For those who've submitted urine samples or other samples, it's a tiny container that's 50 mils where you'd need to cough up your sputum sample and put it in. They will then fill in the correct laboratory form and send that to the laboratory to do your test. The tests are also available in the private sector, but these come at a cost. Okay.
Okay.
So if you visit your GP or your physician in the private sector and they feel based on your signs and symptoms and your clinical examination that you have TB, they will then also request a specimen and submit that to one of the private pathology groups in South Africa. So it is widely available, and there really is no excuse for someone not to be diagnosed with TB if required.
Right. So important. What about treatment? Can you chat with us more about treatment? And also, if a patient feels better while on the treatment, can they just stop the medication? Or perhaps what if they feel the opposite? They feel worse. Should they also then stop the treatment? What are your advices with regards to that?
Okay, so it's very important to know that TB has treatment. Okay, there's specific treatment that's available and you can get better, unlike COVID, where there was no specific treatment available, right?
Yes.
The treatment consists of 4 different antibiotics that need to be taken for a period of 6 months. This is a very long time. I mean, we used to taking antibiotics for 5 days and people can't even finish 5 days of antibiotics.
Yep.
Right? But here with this particular disease, we need to take this for 6 months. And the reason is that TB is a very slow growing bacteria. And I'll give you an example of comparison. If we have a bacteria, for example, that causes diarrhea, the doubling time, so that means for one bacteria to become 2 bacteria, can be minutes and seconds, right? With TB, it takes more than 24 hours for the one TB bacterium to become 2. So it's a long, slow growing disease, and that is why the management needs to be comparable to that. And we need to then address the different phases of growth of the TB bacterium so that we end up killing all the organisms and you get better and not continue being sick for a long period of time. Okay, so it's 6 months of treatment. And what happens is usually when you start treatment, you start feeling better. So if you were coughing a lot and you were having fever, you'd see that after a week or so, you start feeling better. You're not coughing anymore, your fever has subsided, and you're feeling relatively well. But that does not mean that you must now stop taking your TB medication because there's lots of bacteria within your lungs, for example. And we need to get rid of all of them, which needs time. So you need to ensure that you complete that 6 months of treatment, and you must take your medication every single day, not missing a single dose. And it's good to have a buddy when you're on treatment. They encourage you to complete your treatment. They remind you to say, have you taken your treatment today? So that there's a support system that you have to ensure you're completing your treatment.
Support is so important indeed. There were so many other questions that I would love to ask you around TB, but due to time, we're going to have to wrap it up there. We thank you for your time once again, Dr. Farzana Ismail, and may you feel better soon, inshallah. Until then, assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah ameen wa alaikum salam.
And that was Dr. Farzana Ismail chatting with us about TB awareness. Indeed, she's the perfect person to bring us into light with that. It's time for the 11 a.m. news. I'll be right back with you after. Stay tuned.
Urban Woman, sponsored by Vada Gold Gem Jewelers, manufacturers of fine gold, diamond, and platinum jewelry.